Elliott Counseling Group offers a unique model for behavioral health services in Champaign-Urbana. Our services are based on two premises. First, waiting lists are detrimental to positive outcomes, according to the American Psychological Association. Research and experience indicates that timely access to care is essential for improving the quality of mental health care and at times can have life-saving impact. Mental health treatment with long wait lists does not adequately meet the needs of patients, and waiting for care often means care is not received at all. Our other standard at Elliott Counseling Group is therapeutic compatibility. Mental health counseling is not a one-size-fits-any proposition. The therapist needs to have experience dealing with the nuances of specific types of issues. Again, according to the APA, one of the best predictors of client outcomes is treatment fit. At Elliott Counseling, we offer these services, which, when combined, are unique in the community. No wait list. Clients are seen within 3 to 10 days and are offered weekly appointments when clinically appropriate. Therapeutic compatibility. Client members are matched with a provider who meets their individual needs. And weekend, early morning, and evening appointments are available, and we offer a complete client care package that you might not get in a smaller private therapy office, including professional atmosphere, a scheduling receptionist, checking benefits for clients prior to scheduling, filing claims, resolving any problematic claims, and having a clinical director for clinicians to staff difficult cases with. How does Elliott Counseling have no wait list and therapists whose skills, experience, and interest specifically match the client's needs? Well, we hire many experienced therapists who specialize in things such as attachment disorder, OCD and extreme anxiety, trauma and PTSD, addictions, gender issues, eating disorders, family therapist, autistic clients with clinical needs, severe mental illness, ADHD and behavior problems, management of pain, and neurodisorders. We also hire generalists. We have 35 therapists, but to show you how scheduling works, we're going to assume that of those 35, all but 10 of them already have full schedules. Some of these therapists only see younger children. Some see children, adolescents, and teens. Some see young adults. Some work with all adults, or only an older adult population. Some like a mix of all ages. Let's say the presenting issue is a teenager with drug use. We would look for a therapist who works with addiction and who also works with teens. Then we would look at scheduling. In this case, the mom has to transport the teen, so she needs the appointment to be after 5 p.m. or on Saturday. In this case, that leaves us with these two therapists and bingo, an appointment is set for 2 days later. Mom is relieved that we could strike while the iron was hot. But what if someone calls in with something more challenging? For instance, a doctor refers a client to us due to an earlier abuse with trauma. We look for a therapist who specializes in trauma and works with adults. We happen to have 15 of these trauma specialists because as an agency, we specialize in trauma and have had 2 years of specific training offered to our clinicians. Of these 15, 5 are accepting new clients. Then we find out that this trauma client actually has stopped speaking and the doctor has determined that it's a case of selective mutism. We have a therapist who's actually worked with similar cases, but her schedule is full. Yet, we're able to get that client into this therapist. Why? Because the therapist has no wait list. As all therapists do, she has clients that will be terminating or moving from every week to every other week. And because she has no wait list, we're able to ask the therapist to open an extra hour, knowing we're not putting anyone else who has been on the waiting list back in line. It's a delicate balance that we're constantly juggling. That's why we've been so thankful we've not had to also consider, is this clinician, who's the very best fit for your member, credentialed with Health Alliance? That answer has always been yes. And in order to make our system work for your members, we need to continue to have all of our therapists credentialed with Health Alliance, even the new therapists that we're just hiring. Why do your members care if it's Elliott Counseling or some other provider? Well, they want to see the provider that their doctor, family member, or friend referred them to. They want to come to the agency where their family members already get service. And as we stated at the beginning of our presentation, they want to have the best outcome for therapy because of no wait time and therapeutic compatibility. The caregivers locally in the community and throughout the region rely on our services to make sure that their patients' needs are met in a timely, professional manner. Here's what Dr. McCoy had to say. When we get timely and appropriate referral care to meet patients' needs, we have much higher success rates for patients following through on treatment plans. It's not uncommon for the wait time of several months or longer to see a therapist once a referral is made. For a patient in need, not only does this seem like an overwhelming wait, but you can also see a significant decline in their health in that time period. I've been able to work with Elliott Counseling Group in getting my patients seen, usually within a week or less, worked to match the individual needs of the patient with the skill sets of the individual therapist, and accommodating to patients' work and school schedules. And this is what Lurie Hospital had to say. We rely on the fact that when we refer a teen or family, they will be able to be scheduled quickly and will be seen by a competent and gender-affirming clinician. It is essential that Elliott Counseling have the capacity to accept new patients. Please reconsider using the option to grandfather in Elliott Counseling Group clinicians. Thank you for your time, your attention, and your consideration.